The most common cause of hoarseness worldwide, acute hoarseness worldwide, is acute laryngitis. Acute laryngitis is defined as acute inflammation of the larynx accompanied with edema of the vocal cords. And we have to understand the most common cause of acute laryngitis is vocal cord infection or vocal strain. Most of the time, the infectious etiology is viral and it's not bacterial. So antibiotics do not have any role in acute laryngitis. Anybody who suddenly developed hoarseness of voice, okay, especially following or accompanied with a viral fever, has acute laryngitis by default. And the most common etiology of acute laryngitis is adenovirus and influenza virus. And it may be accompanied with or follow high fevers, okay, just like a viral fever or influenza or flu. There may be secondary bacterial infection, but it is not very common. And the bacteria most commonly isolated from the larynx is Peptostreptococcus pyogenes and Staphylococcus aureus. So the most common cause of acute laryngitis is influenza virus, rhinovirus, parainfluenza virus. Though bacterial infection like Haemophilus influenza, Streptococcus pneumoniae can also cause acute laryngitis. I for one feel that after infection, the most common cause is mechanical or voice abuse, and the third most common cause is exposure to, especially occupational exposure to fumes like welding fumes or chemical fumes, and it can occasionally follow people using inhaled steroids. What are the clinical features of acute laryngitis? It's dysphonia or change of voice, alteration in the voice, hoarseness of voice, which is reduction in the pitch of the voice, and it's a very short duration. It's an acute condition. It may be accompanied with fever. There may be other viral syndromes like rhinorrhea, low grade fever or high grade fever. There may be sore throat, and the patient may also have cough along with fever. How do you do diagnostic evaluation? So the diagnosis is predominantly clinical, but you can do rapid influenza test, adenovirus polymerase chain reaction, rapid streptococcus test, and bacterial culture of the throat and endoscopy of the larynx. This is more supportive and it's rarely done. Other than bacterial culture of the throat, other tests are rarely done and the diagnosis is predominantly clinical. So what is the pathogenesis of acute laryngitis? There is edema of the vocal cords or vocal folds. This edema causes aperiodicity of the vocal cords with incomplete vibratory closure of the vocal cords. The vocal tissue becomes more viscous and difficult to mechanically move, and the phonation threshold pressures, they are increased. There is irregular mucosal thickening of the edges of the vocal cord, and most importantly there is lowering of the fundamental frequency of the vocal cords. As you understand, fundamental frequency is the primary note on which all other frequencies are manufactured from the vocal cords. Males have a lower fundamental frequency because their voice pitch is lower. Females have voice is shrill, so they have higher fundamental frequency. Likewise, children also have higher fundamental frequency, which decreases to adult level as the larynx grows. So there is a reduction in the fundamental frequency or the fundamental pitch, due to which the voice appears hoarse, and there is incomplete closure of the vocal folds during the vocal cycle. So these are the pathogenic factors which leads to development of hoarseness, and there is reduction in the fundamental frequency of the vocal cord, which is characteristic frequency of the each vocal cord and each person and each gender and each age and so on. How do you manage? It's a self-limiting condition like common cold, plenty of hydration. It is important to advise the patient not to abuse his voice, especially when there is a hoarseness. So the patient must sustain from talking too much or using voice very forcibly. Of course, if there is pain, you can give pain medication, and if there is, you can also give steroids if you feel that there is more edema. Antibiotics are indicated only in secondary bacterial infection, and which is rare. So most of the time you have to tell the patient to drink plenty of water and avoid, using the voice too loudly. Okay, avoid talking too loudly. What are the main messages? Acute hoarseness of voice is the most common cause of hoarseness in the community, and the most common cause of acute hoarseness is acute laryngitis. Thank you.